go. People will be joining. We just give it another 30 seconds or so.
Yeah. Welcome, everyone. We're just allowing the last few people to be admitted, and we'll get started in just a moment. Hey, great to have you all here. Welcome. We're so happy to be presenting to you today on CBT tools for rapid recovery from social anxiety. It's a treat to have all these folks joining us from all around the world today. We have a lot to try to cover in the hour. We're hoping you'll leave today with some practical methods in hand that you can use to treat social anxiety. And of course, we hope that you'll learn with information about how you can learn more, given that we can only cover a little bit of this great content today. I'm Angela Krumm. I am a co-founder here at Feeling Good Institute and our director of professional development. And I love treating social anxiety disorder. I would say it's the one thing that if I could fill my caseload with, I'd be most pleased with. I also love training other therapists and how to really transform their practice from just talk or support into really having effective methods to help people make lasting changes. I am so happy today to have two co-presenters. The first, Shweta Gandotra, who I especially feel grateful for today, as she just flew in last night from a trip to India and is is recovering from the time zone change. So kudos to her. Uh, Shweta, in addition to being a level 3 Team CBT trainer, a really skilled clinician, is a former university professor. So she comes to us with both academic and clinical knowledge. Shweta works here in our Mountain View, California office and also virtually throughout California. She works with adults, children, couples, teens, so she runs the gamut and treats all kinds of things, including anxiety, depression, substance use problems, attention concerns, and the like. Our third presenter, LJ Davis, is in Georgia and is a level 4 Team CBT trainer. LJ has over 15 years of experience working with concerns such as depression, anxiety, also things like insomnia and relationship struggles. He brings both clinical expertise and lived experience, having personally navigated social anxiety. He now likes helping clients overcome the same. LJ also is a teacher in our Fast Track to Level 3 Deliberate Practice group. So many of you might be familiar with him or get opportunities to work with him in the future. So some of you who are here today, oh, there's our presenters. Some of you who are here today are familiar with Feeling Good Institute. Some of you might be brand new, and we welcome you to our community. FGI has a mission to elevate the practice of therapy so that patients can recover faster and really more fully or more completely. We train and certify therapists in an approach called TEAM-CBT, which is a powerful framework developed by David Burns. And we do this through a structured 5-level certification program that we're pretty excited about. We were founded by Maor Katz, Jill Levitt, and myself. We all met through trainings from David Burns at Stanford years ago. Back then, really the only way to learn Team CBT was to work directly with David and practice with him. And to be honest, it took years to learn the methods. We wanted to spread these methods further and increase client access. And so we started FGI with this really big dream that was to make David's tools, his techniques, and even his approach to teaching more effective and I'm sorry, not to make it more effective, but to spread it more widely and to not compromise quality in that process. So everything we do today still reflects that original intention of helping therapists get better so that patients can get better too. At FGI, we don't just teach people techniques. Instead, we replicate this training style that I mentioned that Dr. Burns showed us and that we've learned more about through deliberate practice literature. It's really this foundational idea that you can only get better with practice and feedback and repetition. And it might be surprising and even discouraging for people to hear that experience alone doesn't always increase therapist outcomes, right? So just doing more sessions doesn't necessarily mean that you're getting better. What we know does work is learning, practicing, getting feedback, and then repeating that cycle so that we can really emphasize the learning and make sure that we're consolidating that learning through practice. So we do that in all of our trainings, including the one that I'll tell you more about a little bit today. Now, before we jump in, I have kind of a silly teaser question for you. And It's to ask yourself, do you want to become a better therapist? And more importantly, are you at a phase in life that you're willing to invest time and energy to do that, to train and practice so you can get there? I'm guessing many of you will have the answer of yes because you're here today, and that shows that you want to grow and learn and improve. And that's what sets apart really, really good therapists who want to move forward. Later today, I'll give you a bit more detail about a program we've created to help therapists level up their skills really quickly. It used to take years of intensive training to learn these skills, and now we've created a highly structured training program that takes 6 months. I believe the course is really effective, and the trainees that I supervise, I require to take it because I've seen how it really quickly teaches them methods that can turn around therapy outcomes. Okay, so many of you are thinking ahead to getting your CE credit for today. You'll be offered one CE credit. We'll put at the end of the seminar in the chat box a reminder that you'll need to do a mandatory survey. And when you complete that survey, it will initiate a process of giving you a certificate. Can take to about a week. So be patient and look for your email. And again, we'll prompt you with that at the end of the webinar. So nothing to worry about today or for now. Okay. Okay, so we have big hopes for our time together today, but obviously we have to simplify to a couple primary learning objectives. So, first, we hope today you'll leave with more ability to identify common negative thoughts that are characteristic of social anxiety. And second, we really want you to be able to describe the purpose of exposure exercises overall and at least take away one that you can start using right away. For example, shame attacking or some of the others, which LJ will teach you about later today. So, towards these goals, we're going to talk about the cognitive model for treating social anxiety. Shweta will share more in that section, and then LJ and I will teach the exposure method, and we'll save a few minutes for your questions at the end. If you do have questions, you can submit them by chatting to Mike Christensen, who's our awesome host and our clinical director here at Feeling Good Institute. He won't be able to answer technical questions if they're about content of the webinar, send them to him and he'll choose a few that we'll do our best to answer at the end. Okay. Okay, so let's start with a brief walkthrough of what is this Team CBT framework so that you can kind of follow along and understand where we're couching the interventions today. So TEAM is an acronym, TEAM. It's a roadmap for how to do therapy. And the beauty of the model is that it's really flexible and it's also transdiagnostic, which many of you know is a fancy way of saying it can work with a lot of different presenting problems or concerns. The framework helps you guide your sessions forward, not getting stuck in just talking or looping around to the same things over and over again, but really creating lasting change for clients. T is for testing. We use brief, validated measures at the beginning and end of every session to track progress and also to elicit client feedback so that we can adjust and learn and grow. E is for empathy. So, of course, before trying to help someone, we have to focus on understanding the patient's experience. We use a specific format for doing empathy, which was new to me when I learned this model and has been transformative. It's useful to build trust and safety, but also to deal with ruptures or difficult communication moments. A is for assessment of resistance. So rather than assuming our clients are ready to change, we slow down at this phase to set specific goals and really identify and work through resistance or barriers to change. A hallmark part of this step that people who learn Team CBT love is something that's been coined as positive reframing, where we actually find the good in what may otherwise be labeled as negative or problematic symptoms. And finally, methods, where we'll spend the most of our time teaching today. Once that readiness is established, we introduce various powerful techniques, and we feel grateful to have a very long list of options available that we teach our therapists, and we can offer the ones that are applicable to the specific client in front of us. The method section is also where therapists are rather integrative and able to bring in methods that are useful that they've learned in other approaches. Okay, so just know that what we'll cover today is just the tip of the iceberg. We can't possibly teach you this whole model. If you find it interesting and want to learn the whole model, then this fast track course that we've mentioned is the next best step. Okay, so social anxiety. It's one of the most common anxiety disorders in the US. The prevalence rates are somewhere between 7 to 12%. But what we know in the research and what most of us know in our clinical experience is that many more people will present with lesser degrees, even if they don't meet full criteria. And so, actually, this is something that most of us see in a large portion of our clients, way more than 7 to 12%. It's defined by a persistent fear of negative evaluation by others, either in social or performance situations. Okay. And it's a heterogeneous condition. And what I mean by that is that it can present differently for different people. Some clients will experience it in very specific, unique situations, and others will experience social anxiety across almost every interaction where they're engaging with other people. So, for example, some people have it more intensely in large groups. They'll sometimes have a specific number. Once I get over 4 people, I feel really anxious. Others have the opposite. These small groups of 1 or 2 feel really scary to them. For some folks, it's about similar aged peers. I hear a lot of adolescents and teenagers who say, I really feel fine if I'm talking to adults, but man, if they're similar aged peers, other people, it's around folks they're attracted to or people of power, right? And so you hear the heterogeneity of it and the importance of finding out the clients you're working with. What are the situations where it presents for them? Okay. What's common and shared across is this fear of being rejected, of appearing foolish, or being the center of attention. So let's run a quick poll. My premise here is this is really common to feel anxious when socializing with others. And I'd love to see from those of you in attendance, to what degree do you feel anxious when socializing with others? So Mike's going to get us started. If you haven't done this before, you should see a poll popping up on your screen and you just click an answer and we'll start seeing the results already. Cool. Wow, look at all the people here today. That's exciting to see you all here and to see these numbers coming in. So far it looks like our big winner is folks feeling a little bit anxious in some social situations. And so actually, if I look at the bell curve here, more of you are less anxious than what I'd expect in a typical population, but we definitely have some percentage of folks who feel extremely anxious and quite a bit anxious, and then a little group of you not at all. That's exciting to hear that some of you aren't struggling with it at all. But what we can assume from this is that, yeah, most of us at least experience a little bit, the vast majority or more. So thanks for putting that out. Okay, wonderful. So, given that, we hope also today that some of you can find some helpful things in this for yourselves, right? Okay, so you might be wondering, how is social anxiety developed and maintained? CBT, cognitive behavioral therapy, proposes that this happens through a self-reinforcing cycle, including negative thoughts, physical symptoms, and avoidance behaviors, right? Negative thoughts such as I'll embarrass myself or the stakes are quite high to impress these people. These can trigger anxiety before or during social situations. And then see physical symptoms, commonly things like sweating, blushing. Oh, I'm a total blusher. I turn red like that. A lot of you can probably relate to that. Or racing heart, right? Even before the presentation, I said, "Oh, let me turn down the air conditioning. If I get nervous, I'll get hot," right? So, um, these physical symptoms can spin up the anxious thoughts and feed them, right? There tends to be a high focus on these symptoms in folks who experience social anxiety. Avoidance behaviors are things like leaving early, being really quiet, or avoiding socializing altogether, right? Not showing up. These provide short term relief to people, but they actually, of course, encourage the cycle because they prevent the person from learning that fears are either unfounded or that they can be tolerated. And so the cycle keeps the anxiety going because the person is really denied the chance to change the negative beliefs or build new positive associations. Okay? So today we're going to talk about a case example of a young woman who I worked with over the last year, who I really have fond memories of and really enjoyed connecting with. Her name is Kia. I'll give you a little introduction and then tell you a bit more about her. And I'll ask you if you can spot these parts of the cycle in her story. So, Kia had a long history of social anxiety as long as she can remember. She describes that experience of being a small child who'd kind of hide behind her parents and her older siblings when they were around other people. Her anxiety led her to describe what she described as extreme people pleasing. And what that meant for Kia is that she was so nervous about getting it wrong or making a mistake that she would kind of never share her opinion, never put out her views about things because she was worried others might judge or dislike it. She tried to kind of fall in line with whatever she guessed others wanted of her. She started working with me after having gone away to college for the first year and coming back that first summer, describing it as kind of a miserable year socially, a huge disappointment. She very much wanted to feel closer to people, but felt kind of isolated and like, she'd show up, but never really got to know people or felt included. She always felt a bit like the flower on the wall. So let's talk about, let me tell you a little bit more, and then I want you to again listen for examples of the negative thoughts, physical symptoms, and avoidance behaviors that might be cycling for Kia. So before Kia would attend a social event, her thoughts would include things like, I have to act perfectly for them to like me. They'll reject me if I'm not fun enough, or I can't do this as well as others. Okay, during socializing, because she was very brave and, some people can't even show up, she would go. Sometimes, often she would go. She'd feel quite miserable though, right? And in one example she shared, she said that she'd been kind of pulled into a conversation where people were talking about their plans for the upcoming weekend. And she noticed her heart was racing. She was feeling heat throughout her body, and she was sure that her face was flushing red. She wondered even if she was visibly shaking. Okay. Then her anxious thoughts revved up, saying things like, everyone's noticing how awkward and anxious I am. My weekend plans will sound so stupid because I don't have anything fun to do, and people must think I'm such a loser. I got to get out of here. Okay. Now, of course, her behavior started changing as a result of that self-talk. She was giggling nervously, fidgeting. She ended up finding excuses to like sneak off to the bathroom and eventually to leave early. And after the event, she would beat herself up. That was a disaster. I'm so awkward. I should avoid those people. I can't possibly see them again in the future. Right. And so hopefully you can spot how the thoughts, the avoidance behaviors, and the physical symptoms are spinning together to reinforce the anxiety. So where do we begin to help someone like Kia? Well, in the team model, you'll see this little icon in the top right corner that shows that we're talking about the T for testing step right now. So we always start with symptom measurement and collecting that feedback that I mentioned before and after each session. With social anxiety, we surely want to also gather specific details. So I told you a story about a conversation at a party. I would want you as a clinician to have a bunch of these detailed stories where you can hear exactly what's happening and spot those parts that are maintaining it. Third, we want to ask about what the client has learned from their culture and environment. So, what are the social expectations in their various roles, from family, among peers, and academic or professional settings, and dating or romantic situations? So, we want to find out how the expectations they learn from family and culture also align or conflict with their personal values or goals for treatment. So, for example, do they want to honor and maintain those expectations, or are they in a place that they're actually wanting to move away from them and challenge them? And lastly, we want to assess whether things like bullying, discrimination, or trauma may be the root of the anxious thoughts and the avoidance behaviors, right? So if Key is withdrawing because the environment is unsafe, then therapy might need to shift towards safety planning, advocacy, or systemic support rather than reframing distorted thoughts and doing exposures. In Kia's case, that was not the case, but we want to be assessing for that and being thoughtful about it. Okay. So we won't be able to teach all of the E and A of the team model today, right? We're going to assume in Kia's case that we had done great empathy and built safety, and that we'd also assessed and melted away any resistance she would have to reducing her social anxiety by honoring the good parts of it, and then also deciding how much she wants to change it going forward. And once those are complete, we're ready to move into the methods section. So I'm ready to hand it over to Shweta, who will talk with us about the cognitive model.
Thank you so much, Angela, for this kind introduction. I'm really glad to be here today and excited to share this presentation with you all. So talking about the cognitive model, which is kind of a psychological framework that explains how our thoughts, feelings, and behaviors, they are interconnected. Our thoughts influence how we feel and how we act. And according to this model, when people experience distress, it's often not the situation itself causing it, but rather their interpretation or perception of the situation. By identifying and challenging unhelpful or distorted thoughts, which is known as the cognitive distortions, individuals, they can shift their emotions and behaviors in more positive directions. So, talking about the cognitive work, it generally, but not always, precedes the exposure therapy. There are multiple steps that we cover with the client before starting exposure work for social anxiety. And in order to best help someone like Kia or any of our clients, we first need to be familiar with common types of negative thoughts experienced by individuals with social anxiety. So, what are some of the examples of negative thoughts that you or your clients experience? Just enter your responses in the chat box to Mike. And Mike, as the responses come in, will you please share some with us?
Excellent. Some are saying they're going to judge me. I'm not good enough. I'm screwed up. They'll think I'm stupid. I'll be criticized. Everybody hates me. Um, I'm going to vomit. I have nothing to say. I'm going to fail. I'll embarrass myself. Boy, they're coming fast and furious.
Wonderful. Here, people, they know about their negative thoughts and they are so apt. And there are these and many others, they come in light when we work with the clients with social anxiety. Uh, Next slide, please. Now, let's take a look at some common negative thoughts that clients experience. While most people may have these thoughts from time to time, individuals with social anxiety disorder, they tend to experience them more intensely and in a more debilitating way. I don't have anything interesting to say. If he doesn't respond, that means my text was stupid. I'm going to mess this up. I might freeze up, forget, sweat, etc. They can tell how nervous I feel. I can't control my anxiety. They are probably bored talking to me. I shouldn't socialize because I'm not good at it. I made a fool of myself. Everyone is watching me and judging everything I do. There are quite a few thoughts I can really relate to. I'm actually having some of these negative thoughts right now as I'm presenting. So, how can we help clients who struggle with negative thoughts? While increasing the awareness of these thoughts, it is valuable first step and an opportunity to offer empathy, which is not enough on its own. We also need to help clients learn how to respond to these thoughts in a more constructive way. In TEAM-CBT, one of the tools we use for this is the daily mood log, which kind of guides clients in identifying, challenging, and reframing their negative thoughts. The daily mood log, it is a powerful tool which is used in TEAM-CBT, developed by Dr. David Burns to help clients identify, understand, and challenge negative thoughts that leads to painful emotions. And using this tool, it helps set the stage for effective cognitive therapy. Some of you may have already used a different version of a thought record, and that's perfectly okay. If the daily mood log is new to you, you can start by simply trying it on a piece of paper, and we will go over the basics together. The very first item number is we have to write down the specific moment at the top of the paper. Write a brief description of a specific situation that triggered a strong negative emotion. Just try to keep it concrete and recent. Second, use the first column to write down the unique negative thoughts. Write down the thoughts going through your mind during the event. These are your automatic thoughts, very brief, believable, and often harsh. Third, use the second column to identify the cognitive distortions. Label each thought with relevant cognitive distortions, such as all or nothing thinking, jumping to conclusion, mental filter. The fourth one, have the client write a rebuttal that challenges and corrects the negative thought. This means addressing the cognitive distortions directly and replacing it with a more balanced, truthful perspective. The client should believe the new thought 100% and it must directly respond to the original negative thought. No superficial or overly positive statements. The goal is authenticity, not forced positivity. And the fifth one, the client will need to rehearse the new balanced thoughts repeatedly. The brain, it takes a time to unlearn the negative thought patterns that may have been reinforced over many years. So consistent practice of these healthier thoughts is essential for lasting change. Uh, Next slide, please. Now, let's take an example using Kia, using a case for Kia over here. The negative thought is they are going to reject me. This thought contains several cognitive distortions, including all or nothing thinking, mental filter, jumping to conclusions. And a more helpful and balanced response might be people rarely fully reject or fully accept anyone. Most people like certain things and may dislike others, and that's okay. I also have many positive qualities that I bring to social situations, like being a good listener, making others feel good about themselves, and being open to new experiences. You can learn more about how to use the daily mood log, identify cognitive distortions, and respond to negative thoughts in any of the Dr. David Burns books, self help books such as Feeling Great. And you can also deepen your skills by attending our upcoming trainings and enrolling in the fast track to level 3 advanced TEAM-CBT course. So this concludes the overview of the cognitive model now, and I will hand it over to Angela, who will walk us through the exposure model.
Thanks, Shweta. That was a great overview and a good starter and for folks who are new, and good reminder for folks who've been using the cognitive approach. So clearly, we believe in the cognitive approach. It's powerful. However, it's not always sufficient for anxiety. And the exposure model is where we invite clients to repeatedly face feared situations in a planned way to move past just talking back to their thoughts, but actually start to face those fears. So there's important multiple steps to cover with a client prior to starting exposure work for social anxiety. So I'll run through these 4 points briefly and then spend a bit more time on the next slides on the first two. So first of all, we do have to explain the rationale for exposure to clients so they can fully understand and buy in. And when I was really new to my therapy practice and exposure, I struggled with this a lot. I found it kind of clunky and I felt a little unclear myself. And so I just challenge you all who are new to doing exposure work to get clear on your rationale first. We'll talk more about it in a moment, because without the rationale being explained to the clients, we would expect low buy-in and low follow-through if they don't kind of get it and see the importance. Okay. Second, we want to prepare ahead by brainstorming possible exposures. I think this is super fun to do. You can be creative and collaborate with your clients in doing it. Yesterday, I actually used ChatGPT to help me come up with some more brainstorming because I was getting stuck with kind of a unique exposure situation, and it was fun to add to my learning there. Third, we want to teach clients to banish avoidance and safety behaviors. So essentially, clients have to confront the fears and take away the things they're doing that are creating a false sense of safety. And those can be then incorporated into our exposures by having them do these harder things without the safety behaviors. Things like using alcohol, or, for in the case of a child, like hiding behind their parents might be safety behaviors. Lastly, we want to build an expectation of repeated practice. One round of exposure is rarely enough. Clients have to commit to this process of exposure becoming a lasting experience, almost a way of life and an attitude that they should implement. Okay, so let's talk a bit more about the rationale since I mentioned it's important. So there's actually various ways in which exposure can be really helpful. And if this is new to you, the site I'll share on the resource side, a treatment manual for social anxiety, can be a really helpful way to supplement your psychoeducation. The first point here is that exposure can serve simply to actually identify new anxious thoughts that were missed. So if you've done the cognitive work that Shweta proposed, you might get out an exposure and they suddenly are clicking with new thoughts that they hadn't realized were there. And so it's an important part of just seeing what other cognitions might we have missed by putting them in the situation. Exposure can also serve to test the anxious thoughts. Is the predicted outcome real? Do people judge them harshly? Does something bad happen? Does the anxiety kill them and lead them to become a puddle on the floor? They have to test these things to find out. Exposure can also create new positive associations through inhibitory learning. So, this type of learning occurs when new non fear based associations are generated with socializing. So, another way to say that is clients can experiencing socializing has a different outcome than expected. For example, if someone has a warm response to them on the street, something like that. Point D here reminds us that exposure helps clients learn simply to tolerate anxiety and break down the idea that it's something intolerable and to be avoided. So, by measuring anxiety throughout exposure using subjective units of distress or some other simple scale, clients can see how the anxiety ebbs and flows, goes up and down. Often, anxiety comes down with exposure, but even if it doesn't, they're going to learn that they can tolerate those high points of anxiety and get through them. Okay. And my favorite way in which anxiety or exposure is helpful for social anxiety is that it can help build acceptance for social mistakes. I'll put that in finger quotes. I'm not sure if they're really mistakes or not, but moments that the person feels awkward. So, who agrees with me? And it's just a thought question that socially awkward moments happen all the time. And thank you. LJ agrees. I used to think I was supposed to avoid them and somehow prevent these from happening. But how enlightening when you realize that they're a normal part of socializing. Communication by nature is kind of awkward and clunky. And that when we stop avoiding them, we're really freed up. So, exposure builds our tolerance for awkward moments so we aren't crushed by them. Instead, we purposely create these social mishaps or, awkward moments so that we learn that we can handle them and tolerate them. And we'll talk more about a specific form of exposure exercises for that point called shame attacking in a little bit. So uh, I also mentioned the fun of brainstorming exposure activities. This is just a quick brainstorm that will lead us into LJ teaching you about a couple of these methods in more detail. So some examples, I want you to always brainstorm things you can do in session with a client on video or in person, and things that you can do out of office with them, or if you're not in a position to go with your clients for exposure out of office, that they can do on their own out of session. So you always want to think of both options here, in session and out of session. And so in session, often it's lots of role plays is a form of exposure. So things that are commonly hard for clients are how to start a new conversation with someone, like how to initiate chit chat. How to end a conversation is really difficult for a lot of people. Even folks who feel kind of socially skilled wonder, how do I wrap this up? How do I end this and move on? And then, of course, handling a social mishap. And your clients will tell you what social mishaps they're worried about. They'll have a whole list of all the things that could go wrong and that they think are scary. And by role playing them, we're doing a form of exposure to confront those. Okay. Out of office exposures, man, there's so many possibilities. Things like asking clients to just greet strangers, say hi, make eye contact, or do self disclosure, chatting with strangers, and of course, anything that draws attention to the self, things like public speaking, or even just doing goofy things in public. So we'll break these down more for you. So why don't let's turn it over to LJ here, who will talk to us about a couple of these cool activities.
Right. Thank you, Angela. I'm excited to get to talk with everybody. And I was nervous beforehand. I'm mostly feeling the excitement now, though. Been looking at the numbers down there. I see 640 people, which means like over 1,200 eyeballs are watching me right now, or most of us. And that maybe brings the anxiety up a little bit to think of it that way. Um, this first thing we're going to talk about is one, all of these are ones that I love. I really do like working with social anxiety, but smile and hello. It's just such a fun way to start. Doing some of the outside the office exposure, though usually I will actually start this inside. So I can think, I used to work on a college campus, which is where I had a chance to do a lot of this. And with students, then we would sit in my office to begin with, and we would look each other in the eye and smile and say hello. And it feels pretty awkward to do that with somebody you've been talking to for a little while. So it already, like Angela was saying, gets us a little bit of exposure just there in the office doing that. And then we would leave the office and we would walk around campus. And most of the time, I would greet the first person, just kind of as a way of breaking the ice. So that's not a hard and fast rule. Um, and then we would go around and greet people and smile and say hello. And Usually it started off scary and fun, and by the end, it was scary. It started off scary, and by the end, it would actually be a lot of fun. And I would start doing silly things like greeting people who were across the road or things like that, and sort of being bigger and more demonstrative. Um, and so we can think of smile and hello really as an early step in a fear hierarchy for lots of people. Um, and it may help a few specific thoughts or beliefs that people have, like people aren't friendly, or no one would want to talk to somebody like me, or socializing is too difficult, or I couldn't handle it if somebody rejected me. And in essence, the technique is really there in the name. We're going to smile and say hello to people, but there are a few key things we want to make sure to do. Angela mentioned banishing avoidance earlier. And that's really what these next steps are about. So we want to attempt with everybody we pass by, because if we don't, our clients or ourselves, if we're doing it ourselves, will kind of subtly filter out people who we think maybe don't look friendly or don't look like they would be interested in somebody like me. So we don't want to let us have that kind of avoidance sneaking in. Similarly with making eye contact, like it's a little bit less intense if I look at my feet or look off to the side. And so those are some subtle avoidances. Same thing with audible voice. We want to speak loudly so that people can hear. And then, like I said, as we go, I will tend to start adding gestures. And so, again, maybe a big wave or something like that that makes it just a little more silly and goofy. Um, and then an important thing, I think, with all of these is to help prep people a little bit for the outcomes. And the way I see it with Smile and Hello, there are kind of three main outcomes we can expect with each person. A sizable chunk of people will be friendly, like they will smile and say hello back, or they'll just smile, those sorts of things. And that's usually pretty easy for us to deal with. There's another chunk of people, and I say this one is growing as people are getting more used to their phones and have their earbuds in, but there's another group of people who will not respond at all. They won't be mean, they won't be cheerful, they'll just kind of keep walking. That may even be the majority nowadays, and probably depending on where you live or where you are, that may be the majority. Um, and then the third one is there's the chance, I've not had this happen very much, that somebody could be, what are you looking at? Or, they could have some sort of grumpy response. And so just to be prepared for all those. And actually, in my ideal world, when we would go out, I would try to make sure we talked to at least 10 people. And if I could set it up, which of course I can't, we would have at least one of each of those kinds of people so that our clients get the chance to experience that a rejection or a grumpy person doesn't really destroy them. It's just like, well, that okay, let's go on to somebody else and we can keep going. Let's go on to the next slide, Angela. All right, and so self-disclosure is really based on the idea, at least as an exposure technique, is based on the idea that shame is one of the biggest parts of our social anxiety, that we have something we're feeling like we need to hide and that we're ashamed of. And I actually got the opportunity to do some self-disclosure of my own a few years back. I have a tendency, like one of my little pitfalls is that I think I should appear emotionally perfect. And so I shouldn't feel afraid or sad or angry even. And so I got the assignment to go somewhere and say to people something like, my whole life, I've felt ashamed of a lot of my feelings. I felt like I should hide anger or fear or sadness. And I've decided to stop doing that. And that's why I'm telling you about this today. And it was really a pretty amazing experience. One, just telling people that I do this, like I also felt ashamed of this pattern. And so disclosing that pattern to people was a huge thing for me. And the way people responded was also pretty amazing. I would never have guessed the kinds of responses I would get. The first person I talked to, I was probably very fortunate with this, was just like immediately open and actually she gave me a hug, and then she's like, wait a minute, I'm not really a hugger. And we started talking and had just like one of the best connections I've ever had with somebody that quickly. Um, and then I did have somebody at the end who his response was, well, why do you do that? And so I did feel a little bit judged, which helped me to have that experience and see that I could tolerate it. And then we talked some more, and it turns out his partner has a similar pattern and he gets frustrated by it. And so in a way, he was wanting to understand, but it still felt pretty judgy for me. So that's kind of the power. And you can see, if we think about Kia, one of her worries was that people could see that she was feeling anxious and that they would reject her as a result. So self-disclosure can be a powerful way for her to face that fear by telling people she's feeling anxious. And we want to coach our clients to do that in a skillful way. And then she can let people know that she is shy and she can find out if she's rejected or not, and then she, gets to find out if she can tolerate that rejection. And she also probably finds out that most people will not reject her. Most of us can relate to feeling some sense of shyness. um, and then it might also just be a powerful way of getting around some of the avoidance she does, like trying to hide different things. And so that's also a powerful part of self-disclosure. And we'll see in the next slide, please, Angela, some examples. Here's a way that Kia might have gone and spoken to somebody. Again, could be on a college campus or at a social gathering of some sort. And she could just say, "Can I speak to you for a moment? I want you to know that ever since I was a kid, I've struggled with shyness. And I've also felt really ashamed, so I've been hiding it from everybody. But today I've decided that I'm not going to be ashamed or hide it anymore. So instead, I'm telling people that I'm shy." And then you can see she also added a survey onto the end of it. What are your thoughts about being shy? Is that something to be ashamed of? And so you can imagine what kind of responses she would get to this sort of disclosure. And there are a few key points that I want to make about this as well. One, we also want to help Kia be prepared for the variety of outcomes that may come her way, and just be aware that this may happen, and that it's actually great if we get all these different sorts of reactions. That's the way I like to frame it, that getting a rejection would actually be a great thing. And here's why. Um, I also encourage my clients, and this is what I did too, to write it down on a note card, or of course, this being the 2020s, put it in your phone. And I don't want them to go and read it to the person they're talking to. But when we get in that moment and we start feeling flooded, really easy to lose those words. And so having them somewhere where they can read them, go to the bathroom and read them, or just like read them and remind themselves before they engage in the conversation, so they can really have the words fresh for them, I think is also really important. And we can go on to the next slide for one other kind of self-disclosure. Angela did a little bit of this self-disclosure earlier, where she mentioned that she blushes. And so people who are worried about their anxiety are also often worried that people can see it, and they can see that they're blushing. I know my hands shake sometimes, and sometimes I do worry about that a little bit. And so that's another thing that our clients can self-disclose. Instead of trying to pretend I'm not blushing or trying to hide that I'm blushing, I could just say, I don't know about you, but sometimes I get really anxious at these events, or it can be so awkward chit-chatting, and I can tell I'm blushing and shaking right now. Do you ever feel anxious or nervous at these events? And so then, like for me, when I self-disclose things like this, there's just kind of a sense of freedom that comes to, like, okay, I'm done with trying to hide that. And that's a real gift that we can give our clients as well, so they don't have to hide. And then they can move into hopefully feeling more relaxed, or continuing to repeat the exposure and getting that benefit over time. So thank you so much. I'll pass it back over to Angela, who's going to take us into shame attacking. Oh, you'll need to unmute, Angela.
That's helpful, isn't it? To unmute. LG's just given us a real gift as humans who, all of us probably struggle at times, at least with the performance part of anxiety, this idea of self-disclosure. And I've taught, folks at the Meta and uh, Apple and the big companies, high level folks who just now open presentations with this type of disclosure. And they find it so empowering to just say, I care about this topic so much today that I'll probably get kind of nervous and my voice might shake. I'm glad I have my water if I, get that dry mouth, and then they move on, and people seem to feel warm and supportive from that self-disclosure. So thank you, LJ. I hope folks can experiment with that in their own life. I do want to talk to you about shame attacking because it's such a cool, powerful technique. So some of you may have heard of this through like popularized media. There's something on social media commonly referred to as the comfort crusher movement, if you want to look that up for kind of real world examples of this. In the academic literature, this is referred to as social mishap exposure. So if you want to read the academic side, you're going to do searches for social mishap exposure. It's all kind of the same spirit of things that we refer to as shame attacking. So what is it? Well, it's going out in public and doing things that draw attention to the self, and things that are kind of over the top, goofy, outrageous, purposely drawing attention to ourselves. And we think things like dancing on a street corner, wearing clothes that your client might perceive as like outrageous or attention getting, singing a song in public, riding a bus and reading aloud every street sign that you cross at the intersections, really the options are endless. Why do we do this? Well, remember that most people spend their lives trying to avoid things that feel like awkward moments or social mishaps. And if we are too focused only on the cognitive therapy approach, therapists might even encourage this. They might be encouraging their clients to fight back with thoughts that say, awkward things will happen, with responses like, oh, it doesn't happen very often. I'll do fine socially. I won't ever make a big mistake. I don't have to worry about it. And actually with exposure, we're saying, hey, let's just go into it. Let's not just avoid, let's not just give up our fear, but let's create these moments and celebrate them. And so shame attacking does this over the top way of diving in. I do encourage you to do it yourself before you ask a client to do it. And if you ever are in the Bay Area, I'm your person. I'd love to go out and do some shame attacking with you. It's super fun. I think I'm probably the most odd person in downtown Mountain View because the amount of time I spend downtown doing goofy things in public. And I still get a little anxious every time before I do it, which tells me I got to keep up the rhythm. Um, so this is something that we did with Kia. Actually, all of these exercises are ones that Kia did in the course of her treatment. Let's talk a little bit about some of her outcomes. So she had specific learning from the exposure activities. She learned things like that she could, in fact, tolerate socially awkward moments, that her anxiety didn't stay that high, but actually did come down with repetition. She also learned that people didn't judge her as harshly as expected. An example of that was Kia was someone, remember, she felt like she shouldn't have an opinion or inconvenience anyone. And so one exposure she did was going into these bakeries and she had to ask like 3 or 4 questions and then walk away without ordering anything. And this was atrocious to her. It was so awkward to her to do that. She felt like she was inconveniencing someone and, putting someone out. And so her learning was people actually didn't judge. Like there's space in the world for her to have needs and opinions. And it was really sweet and powerful. Overall, in the treatment, she picked up some larger learning, like that her anxiety came down in normal daily social activities. She felt closer to a handful of other people. And she was doing greater social risk taking, so sharing her opinions more, feeling willing to vote for where they go to lunch, or speak up about things in her groups. And I think that was contributing to her feeling closer to others. So we're going to do a couple of summary points here. I'm going to remind you then about some resources to learn more. Make sure you have that CE survey and do some Q&A, okay? So a few reminder points here. We want you to leave today remembering that social anxiety is quite common, that there's a number of common negative thoughts involved in social anxiety. A couple of the themes are that there's a low belief in their social abilities and a high belief in the costs, right? So the stakes are high and a perception that their skills are low. Anxiety is maintained by avoidance, and that exposure is the key to banishing avoidance. And so we want to think less talk, more exposure, less talk, more exposure, and get them out there doing things. Um, so a couple of resources to help you dig further into social anxiety. When Panic Attacks is the name of the self-help book written by our mentor, David Burns, that specifically focuses on broader anxiety with lots of examples of social anxiety. And then below that, you see my favorite treatment manual from the Treatments That Work series by Hope Heimberg and Turk. They have both the therapist guide and a client workbook. You can use one, you can use both. Great resources in there, including worksheets and helpful guides that you can use to supplement your work. And that fits really well within the TEAM-CBT model, right? It just gives you kind of some structure and information to facilitate your learning. And then, of course, you've got access now. You know about FGI. We have all these certified trainers who can do consultation for you, people like LJ and others that you could reach out to for case consultation. And if you're someone who believes in exposure but doesn't want to do it yourself, reach out to us, right? You could refer a patient to do a bit of exposure work with one of our therapists and then come back to you for the rest of their work. We believe in it so strongly, and all of our therapists here at FGI are equipped to do exposure with your clients. So if today's content has sparked interest for you in learning more about TEAM-CBT, I mentioned to you that we'd tell you about a course. So we'd love to invite you to join the Fast Track to Level 3 certification course. It starts June 20th, so right around the corner. And this is the most efficient and streamlined way for you to become a truly excellent TEAM-CBT therapist and really up your skills, up your game. I know this slide is packed. I don't expect you to read it all. It's just to give you a bit of a picture of what's included. And I'll tell you some of those highlights now. So it's a hybrid course, to make it accessible for folks who are busy and got lots going on. So you have 16 hours of asynchronous content that you do at your own pace. And then you get this really cool live half-day training that has a real-time therapy demo with Dr. Burns, which is really a neat special opportunity. And probably most importantly, you get 25 weeks of small group coaching and live practice. I mentioned earlier that cycle. You like learn something, try it, get feedback, try again. So that's deliberate practice, right? When you enroll, you'll also get free level 1 and 2 TEAM-CBT certification. So we'll welcome you to the community with that. You'll get free access to level 3 exam prep. There's a exam to get level 3 certification, and David Burns' full therapist toolkit, which includes all of his materials, like when Shweta mentioned the daily mood log, and hundreds of other tools and techniques, mood surveys, things like that. Uh, New is we're offering a 30-day full refund. It is because we believe so much in the course. We're saying, hey, give it a try if you're nervous about it. If for any reason you're not happy with it, no questions asked. We'll just refund your money so you don't have to feel concerned about any risk. Mike already has or is about to put in the chat box a link if you are interested in registering, fasttrackcbt.com. There should be a promo code there as well. Skill up 50 will give you $50 off your registration there. We get good feedback about the course all the time. This is Sarah Chickering, actually, who I know and adore, and talked about this being one of the most transformative, best decisions she's made professionally. Sarah, you're probably here today, so thanks for sharing that quote with us. Cool. So let's do some Q&A. If you have not already chatted a question to Mike Christensen, now's the time. I do want to protect Mike and let folks know he won't be able to ask them all. So he's going to pick a few that he thinks might be most relevant to the whole group. So Mike, feel free to poke at who you want to answer as well.
Yeah, there's been a number coming out throughout the workshop, so I'll read some of the ones that are thematic with others. So if we don't get to yours, it might be similar to the other question. One of the questions is, are relaxation strategies taught and encouraged or contraindicated? What about the use of positive mental rehearsal, and how and when do you assess for secondary gain? I thought those were some good ones.
Mm.
I have
Who
some
would you like to go ahead, let LJ? Perfect.
Yeah, I have some thoughts on some of those. Um, Especially the secondary gain part is actually a key part of the agenda setting that we didn't go over. Dr. Burns would say there's no such thing as secondary gains in America today because he feels like maybe there's a little bit of shaming to that language. But when we're doing our positive reframing, we go through what are the really great things about your symptoms. And so we do have a chance for clients to see that there are good things, good benefits to what they're experiencing, and it says good things about their values, and then to talk back and say why they would want to change anyway. So we don't try to argue clients out of their secondary gains. We let them do that after we've highlighted what they are through that agenda setting process. Um, there was two other questions, I think, Mike. One was about relaxation techniques, and I'd love to hear Angela's answer on that. I kind of go back and forth on that one some.
Yeah, because the literature goes back and forth. So some people will pair relaxation training exercises with exposure for, all kinds of anxiety disorders as a way to maybe make it a little easier on the client. So you partner some calming, soothing activities with doing the exposure. I find most of my clients don't need that, and it actually just kind of slows down the process of recovery. I have an attitude that clients are extremely capable of doing hard exposures if someone really needs it, if they're so activated that they cannot get through an exposure, then by all means, and really you can think of those relaxation strategies as just part of a hierarchy where you might have them using these skills to kind of self-soothe in the process. And then as they build confidence, they can take those away. And so it'll depend on the client. In general, I think as therapists, we're too nervous about exposure. We think clients can't handle it, are going to be harmed by it. And actually, we're kind of feeding into the fear there. So, in general, we want to have the attitude that people are tremendously capable of doing these hard things, and you'll meet them where they're at. So, if that includes a little relaxation training first, that's okay. Right? We'll hope they can build up over time and do it without.
Question for you, LJ, regarding kind of smile and hello and some of the shame attacking. concerns about where they're at in the culture and safety. Somebody had said, what if they live in a big city like New York City? And so how do we navigate that? Or also if there is some difficulty that they're having physically, or somebody had said, what if they've got Tourette's and they yell out? How can we utilize those? So some of those, where is it appropriate to use these techniques?
Okay. I love that question, Mike. Thank you, and thank you to whoever asked it. Um, I mean, I think on the streets of New York City would be a great place to practice smile and hello practice. And so I'd say go for it. And you may get more experience with people ignoring you or rejecting you or, using colorful New York phrases, but we can learn that we can tolerate those sorts of things. As far as the cultural aspects, I think Angela mentioned that's a really important part of the history taking and assessment. And we want to help our clients recognize their cultural things and then for them to make a decision. Is this a cultural standard that I want to continue, or is it one that I want to shift my relationship with? And we would, work with them on figuring out exactly what that is. I was thinking about the eye contact when I lived overseas in a culture where eye contact was considered disrespectful. And so in that case, we probably wouldn't want to use eye contact while we were doing that. And so we can certainly tailor some of these things to get those culturally appropriate interventions. And there was one more, my memory only goes to two questions, it looks like.
I think I kind of capture both of those there.
Okay.
Angela, I'm
Awesome.
just looking at the time here and know we want to get the C credit into the chat box now and have a couple of minutes for a couple of wrap up things. Should
Yeah,
we do
we
that
probably have
now?
time for, how about one more question?
One more
Because it'll
question.
just take
Great.
me a
Here's
moment to remind them
here's
about
one other
CBT.
real good one here. How would you support someone who gets so anxious they go into kind of freeze mode and even go dissociative? They feel foggy and have trouble formulating sentences, leaving them more anxious. Um,
Mhm.
Go
Yeah.
ahead.
Shweta, did you want to jump in on one or you want me to take that?
I can take that, and like we can start with the daily mood log over there with the client. Like the cognitive work is very important over there when we start with a highly anxious client. So building that rapport when we have talked about the team model. So empathy is like very important and basic thing, and after that the whole team model, and then daily mood log. Like I've mentioned. Talking about the negative thoughts, why the client is anxious at that moment, and what are the different emotions they are feeling while going to the specific event. Like we have mentioned, the daily mood log, the first step is about going and looking for what is the specific event, one moment in the time. And from there, we are able to find out different emotions. And with the emotions, from there, finding out the negative thoughts and taking out the cognitive distortions, like I've mentioned, working on the daily mood log, and then bringing the positive reframing and rehearsing it. So I believe this is the first and the basic model and mode for the highly anxious client.
Perfect. I think that's so important because if they've done the cognitive work in advance, they're less likely to freeze. I would add if you're also in an exposure, I was thinking more about that part. Let's say they're already doing an exposure, then how do we help with the freeze in that moment? So Shweta's talking about the preventative part. In the moment, there's a real benefit if you can be with your clients when they're first doing exposure. And so if you have an in-person practice, you're ready to go. If you're virtual, you may decide, do you have a system that you can join them virtually by taking a mobile device with you, or is there a partner they can have? And you can prepare ahead for freezing. So normalize it. They may freeze, they may get nervous on a certain step and have a plan. If you're with them, you want to have prepared them that you're going to gently nudge them forward. And if they really refuse to move forward, like a full freeze means I cannot do this next step, like I cannot say hello to this next person walking down the street, then we can always have an agreement to take a baby step back, right? So we're going to go back and repeat the last exposures until they feel ready. So we could fall back to just making eye contact again or whatever was the previous step. What we don't want to happen in the middle of an exposure is to give into a freeze and quit because then the brain has learned that it is in fact insurmountable, that the only way to reduce the anxiety is to get out of the situation. That's the opposite of the learning. So absolutely preventative, freezing, all the awesome cognitive stuff Shweta reminded us of, and then have a plan for in the middle of an exposure of what will they do if a freeze happens, whether you're with them or if they're on their own. So I want to answer more questions, but I think we do have to wrap up. So, Mike, hopefully you've put that link in the chat box. If not, please do it now. So this is your mandatory survey for those of you who want a CE credit today. I do expect it may take about a week to get your certificate emailed to you. If you have any questions about that, you'll reach out to certification@feelinggoodinstitute.com. Again, give it about a week, but do the survey now. That's your best bet. And then just want to thank you all for joining us today. We hope to see some of you on June 20th in the Fast Track course. Also, there's a QR code if you're interested in becoming a client yourself at Feeling Good Institute or referring a patient. We have a directory of all of our awesome therapists, including Shweta and LJ and a bunch of other people around the US and Canada who can work with you or our clients. And of course, the information for the Fast Track course. So take care, everyone, and we hope to see you at a future webinar. Bye-bye.